A grim report from the National Institute on Drug Abuse. Maryland has one of the highest rates of opioid-related overdose deaths in the country. Now, Congressman Elijah Cummings is hoping to cut down on that. He is introducing federal legislation to fight the opioid epidemic nationwide. WJZ's live political reporter Pat Warren has more on the plan. Pat?
Well, Mary, sadly, that same report says the overdose death rate in Maryland has consistently been above the national average since 1999. The epidemic nationwide has gone from prescription painkillers to heroin and now to fentanyl.
We are unresponsive. The third is still unconscious, but he's breathing on his own.
You know people that are here today and gone tomorrow. It's just that quick.
In Maryland alone, fentanyl overdoses have gone from 25 in 2012 to 1,700 last year. Maryland Congressman Elijah Cummings is proposing a federal commitment of $100 billion over the next 10 years to fighting the opioid epidemic, based on the same model used to fight AIDS.
Some of the greatest advocates of this kind of legislation are people who have been affected by it. A family member, a cousin, employee. And I expect that there will, because the problem is growing at a phenomenal rate, sadly, there will be people who will be affected by it. And they will come and they will try to help us.
The Centers for Disease Control says in a 15-month period, there were more than 142,000 suspected overdoses, an increase of 30%. Cummings believes his bill could pass, but must first get past the stigma of drug addiction.
They said, oh, you know, that's a moral failing. But it's a disease and we need to treat it like that.
$500 million a year would expand access to the overdose reversal drug naloxone. And $4 billion a year would go to states, territories, and tribal governments. I'm Pat Warren reporting. Now back to you.
Pat, thank you. Massachusetts Senator Elizabeth Warren is sponsoring the bill in the Senate.